Hi friends, we are here in a very nice environment and we're lucky. I'm sure you are also lucky. We are having a special guest on our show, Dr. Puviarasan. He is an eminent gastroenterologist and he works at Salem SKS Hospital. So sir, thanks for being on the show. We are going to be talking here today about peptic ulcer. It is a very common problem. Burning sensation in this area. You don't know what the problem is. It is called peptic ulcer. So he is an expert on that. We'll just ask him about that. Sir, what is this peptic ulcer and why do you feel this ulcer is comes actually the starting point and how we should take care of it?
Actually, peptic ulcer diseases manifest clinically as pain above the umbilicus. This is we call it as epigastric region. Patient will have pain above the umbilicus.
Right.
And this pain can be mild or this pain can be severe.
Okay.
And typical presentation of peptic ulcer disease is that a patient will have severe pain whenever his stomach goes empty, and whenever he eats, his pain can come down. This can go vice versa based on where the ulcer is. If it is in the stomach, your pain is going to increase with food.
Right.
If it is going into the duodenum, your pain is going to decrease with the food.
Oh.
Whatever it is, both combined together is called peptic ulcer disease.
Lovely.
And this peptic ulcer comes whenever there is a disturbance in the homeostasis of our gut, mainly stomach and duodenum. What happens is that when the acid secretion increases, when pH goes below to certain extent, what happens is that your small intestine might not be able to deal that amount of acid that's entering into small intestine, and you might get ulcers in the initial parts of small intestine, that is duodenum.
Okay.
And you are going to get pain. This is one form of getting pain in the small intestine. Even in the stomach you can get ulcers. In stomach you can get ulcers whenever the mucosa, which is nothing but the protective layer between the stomach and whatever the food we eat, when it gets atrophied, that can go for ulceration, and you can that can manifest as an ulcer.
Okay.